Katrin Allred is the Director of Education Programs at CNM. Giovanna Rossi is the owner of Collective Action Strategies, and Haley Hines is the Senior Policy Analyst for the Center for Education Policy Research at UNM. Thank you, all three of you, for being with us today.
Thank you.
Haley, New Mexico got one of the lowest cumulative scores in the CARE report, and that's because daycare is in part so expensive that many families can't pay for formal daycare. This is what the report found, that the average cost of daycare for a preschooler in New Mexico is nearly $9,000 a year, and that's more than tuition, in-state tuition here at UNM. To have a nanny work in your house is an average of $27,000 a year. You could buy a Subaru Outback for that. Maybe not with leather, but a pretty nice one. And the average New Mexican pays more than 1/3 of their household income for childcare. This is a lot of money. Why is it so expensive?
So that's a great question, and I think it's one that a lot of families wonder about when they're sort of searching for good care for their kids. I think a really important piece of the New Mexico context is that percentage of household income, because it's not really that care is more expensive here, it's that people have less, right? And so this idea that care is more expensive in New Mexico, well, yes, as a percentage of income, right? Because people have lower incomes here, and so paying kind of a pretty typical national rate is a much larger burden on a New Mexico family with a lower income. Just in terms of why it costs so much, that is interesting, because you would think that like someone would be getting rich off this system, right? I know people who think this, and it's just not true at all. Like, in fact, we'll talk about this, but this workforce is very poorly compensated in most cases. And the owners of centers are also not getting rich. This is just, nobody's getting rich off this system, but it's expensive because of ratios, because it's a really sort of human capital centric thing. It's all people doing work. There's nothing automated. There's not a lot of, other costs really surrounding it, but you just have to have lots of people to have good high quality ratios. We don't want 10 infants in a room with one grown-up, right? And that's, so we can't have that. We want there to be lots of loving adults taking care of kids, and just staffing that many people is an expensive endeavor. And it's the sort of thing that the sort of typical markets don't necessarily bear, and we don't have like a lot of subsidy for it in the same way. I mean, for higher income families, that we do for things like K-12 education, where we say like, yeah, that's too expensive for a family to pay for, so we subsidize it.
That's a good point. And Giovanna, I want to ask you about this change in society that we've seen, where most parents are now working, and so we have a greater need for childcare. The report includes several policy recommendations, and one of them is paid family leave for all parents. I dug into this a little bit, and I thought, oh yeah, we don't have that here, but who does? And virtually everyone else does. The only countries I could find on the map were Suriname and Papua New Guinea.
Right.
So why does everyone else do this, and our federal government does not provide paid family leave to new parents?
Yeah, well, I mean, I'm glad you brought this up in the context of childcare, because we've seen women in the workforce increase over the last decades. We've got 47% of the workforce is women now. And so we've seen the changing role of the workplace, or the changing of the workplace over time, but we haven't actually seen the policies catch up to meet the needs of the new workforce. So we really need to take a step back and look at this in context. And we are the only industrialized country in the world that doesn't actually have any paid leave. We do have unpaid leave. So we have the Family Medical Leave Act. That's great. It's good that that's in place. That protects women for leaving to have a baby and come back 12 weeks later. They've got their job still. But it's unpaid, and I don't know that many women who can afford to take unpaid leave. So the fact is, we do have a bill, co-sponsored by Representative DeLauro and Senator Gillibrand. It's called the Family Act. It would put in place a family medical leave insurance program to create paid leave. It hasn't gone anywhere.
And it probably won't now.
And it probably won't, although it is interesting that both presidential campaigns did put in their speeches and platforms towards the end of the campaign that they would address paid leave. So it's not hopeless, but it is, I think it's something that more people need to be focused on.
And other countries, one of the reasons they do this is because if you can pay for people to stay home and get back on their feet, so they get back into the workforce, ready to, I mean, is there an economic argument for this?
Oh, definitely. I mean, there's a business case for paid leave, which is, actually there's a survey from the Small Business Majority that shows that more small businesses support paid leave than oppose it. And there's a definite business case for paid leave in that it supports people, less turnover and people staying with their jobs and more loyalty, frankly, amongst employees. And there's a case for the economy, which is what you brought up, which is to say that if people stay in their jobs, the economy is stronger. And so there's actually a part for everybody to play in this. And it is doable, but we need to figure it out.
I'm going to ask you more about that in 1 minute, but we brought up this idea that infants need a lot of care, and without paid leave, we are putting babies in childcare pretty early so that moms can get back to work. And Katherine, when you send your newborn, your 6-week-old baby to childcare, one of the things that you're probably really concerned with is the quality of that care. This report showed that in New Mexico, a lot of people who don't have the money to pay for formal care lean on their friends and family. Is that care as high quality?
I think it can be. But it's also really important that when you're talking about quality, you're really looking at the system of support that surrounds the child's growth, development, and learning. And so while friends, family, and neighbor can be those people that support that, this is where I really think we need to change our thinking dramatically about what childcare is, and really change the language to the fact that it's early care and education.
It's not babysitting.
It's not babysitting, and caregivers are educators, because every environment that a child is in is an educational environment. And so a skilled educator understands that. They know the science of development. They know brain development. They can build age-appropriate activities that really support that child's growth and development. So while we can look at structural quality of ratios and things that we need to have regulations on, we also know that a child's future success is based on meaningful relationships and that active brain development in those critical 0 to 3 years.
So that could be grandma who's got a lot of experience and knows about brain development and has a really meaningful relationship, but that could be a very well-educated stranger who becomes a loving caregiver. Haley, you've done some research that's New Mexico specific, but that sort of hits the same areas as the CARE report. Do those national findings that childcare here is harder to get, more expensive, and of reasonable quality, do those track with what you're finding?
Yes and no. So part of, I think childcare is a really large picture, and there's a lot of aspects of the system. And the New America report really sort of zoomed in, I think, on home-based care and sort of informal care structures. Like they really, in their case study of New Mexico, spent time there, which is really important. But anytime you zoom in on sort of one part of a system, you're seeing less of another. I have spent more time looking at licensed care and childcare assistance. So that's state subsidy that the state pays to help low-income families afford childcare. And so that's what I know a little more about than this sort of these off-the-grid childcare arrangements that people are setting up. I would say that a lot of what they say sounds right to me. I think that New Mexico, the picture's a little less bleak to me. I think that there's some really good stuff happening, especially around quality, in terms of really trying to get quality to a good place in terms of trying to train up the workforce and trying to get ratios in a really good place and trying to do really good best practices. So I think we can feel pretty good about a lot of the things that are happening in the world of sort of high quality licensed care. But there is always sort of an interesting tension between quality, access, and affordability, which are these three kind of areas that I think those of us who think about this stuff think about that as the language of it. And so, for example, something that's happened in New Mexico is in licensed care, quality standards have gone up, and CYFD has really increased the reimbursement rate to pay for that quality. So that's quality going up, right? But now you are paying quite a bit more per child. And so if you have a finite pot of money, does that have an impact on access? Now, with the same pot of money, if quality is up, but fewer children can be served if funding doesn't rise.
You've just got to keep balancing
So,
those three.
Yeah, and trying to think about how quality, access, and affordability are in tension with each other, what relationship they have to each other. And so in terms of people trying to make good public policy, like that's always going to be a challenge here.
Katrin, you at CNM are training people to be skilled child care workers, to raise that quality, to meet the demand for more qualified folks. They can earn associate's degrees, but how much money can they expect to earn then?
So at CNM, we really support what I would call the career ladder in early childhood. It starts with the entry-level 45-hour course, the 4-course child development certificate, all the way to the associate's degree. And so you'll see the wages there being from minimum wage all the way to about $15 an hour.
And then, but as they get more trained, do they then go for higher paying jobs?
Absolutely. Turnover in early childhood is around 33% a year, which really comes back to impacting that quality, because you can't build meaningful relationships with families and children with a turnover rate at 33%. And the other thing is that when our faculty and students, they move forward in their career to bachelor's degrees, they tend to go to public schools. Because public schools have a living wage. They also offer benefits, things that you often don't find in private early care and education.
So one of the balancing factors here is trying to keep the pipeline coming of good people and try and keep them in place.
Can I just jump in on the
Yeah.
on the workplace, on the childcare accessibility and affordability? I think in terms of workplace, which is where I'm coming from, in terms of workplaces, there is some opportunity to create affordable and accessible childcare and quality as well, on site or near site to the workplace. And
For employers to do this for their employees.
right.
Yeah.
And so then you have a situation where the employee has their child right there in the building or nearby. So if the mom is still breastfeeding or needs to feed the baby, pump or whatever, the child is close by. We have some examples of that here in New Mexico. It hasn't been something that lots of businesses have adopted yet, but we're seeing more and more examples of that. And we're hoping that we share those examples with businesses and they can learn how to do it and how it's affordable for them to do it.
And this is a program that you're working on now called Family Friendly New Mexico, encouraging businesses to voluntarily make this situation easier. What are some of the things you're doing?
Yeah, so Family Friendly New Mexico basically supports businesses to adopt and implement family-friendly policies in the workplace for employees. And those policies,
like paid leave?
those policies include paid leave. They include flexible scheduling, job sharing. All of these things help moms and dads balance their responsibilities of work and childcare, family responsibilities. It also includes things like retirement, healthcare, complying with laws that we have in place, like the breastfeeding law, which requires you to have a private, place to pump breast milk that's not a bathroom.
So if more businesses do on-site childcare, if they offer paid leave, we could alleviate some of the demand out of the rest of the system and allow that to equal it out a little bit, Haley?
It's certainly the more people who are helping with this system, the better the system can be. There's this great workforce report that has come out of Berkeley, and they have this. One of the things that they say is that essentially we have subsidized the childcare system in this country by paying the workers insufficiently. That's who's propping it up, is people who are doing work for which they're essentially not fairly compensated in terms of pay and benefits. And so that is not a sustainable way to subsidize a system that's so important, especially given the more we know all the time about how important it is, about those sort of early years and brain development, and with the changing sort of texture of American families, it is more important than it has ever been. We have more understanding than we've ever had about how important this system is. And so to continue sort of like having it propped up by folks who, in many cases, make minimum wage and don't have health benefits, not all cases, but it's not rare. Then we need more people doing stuff, right? So if businesses jump in, I mean, certainly the state of New Mexico does heavily subsidize this sector. About $97 million a year in sort of state and federal funds goes into childcare assistance to help sort of ensure that low-income families can afford quality. And that heavily props up a sector where, in many low-income parts of New Mexico, without childcare assistance, there wouldn't be enough private dollars in a community to support a high-quality center. So there needs to be a variety of supports from different people. Parents can't do this by themselves. The state can't do it. It's really not, I would say, a sustainable model for center owners and employees to do it. I mean, there needs to be a lot of people buying into the system and trying to make it better.
We have about 1 minute left. So I want to ask you, Katrin, if you had a magic wand, if you were the ruler of the universe, and you could just make one change that had a really big impact on this system, what's one thing you would do?
I think we really need to look at, as a society, how are we going to invest in early childhood? And that includes in the workforce, it includes accessibility, but it is severely underfunded for what we understand is the importance of those foundations.
Investment. Giovanna.
I would say, as a new parent, it's the most difficult, emotional, and just difficult decision to make to go back to work and leave your baby somewhere. So if we can get buy-in from the different partners and the different stakeholders, like business, like government, like parents, I think we can together come up with a system that works for everybody. It's a win-win, actually, for everyone.
Including paid family leave.
Including all of the policies, yeah.
And Haley, one thing.
This derives from investment, but it has to do with honoring the workforce, and that means paying them appropriately and giving them the benefits they need, but also like changing how we talk about this workforce, talking about them as teachers, not using words that demean the importance of what they do, so that this becomes something that like people aspire to be, and that we hold up as having the importance that it does.
Thank you, all three of you, for that insight today. Thank you.
Thank you.
Thanks, Gwyneth.